safe. And then came the lot of hackings and those things. So the people were starting to lose trust on our cloud infrastructure. So I made an algorithm with which I hope the cloud is made more available, cheap, and at the same time most secure. With my work, I hope individuals will have a better sense of their personal data security. At the same time, financial institutions like banks and other things can have more secure transactions. And I also hope my initial work is implemented by others and the amount of work is improved. Thank you.
I call Mr. President to give the award to Srinath sir. Now about hygiene, sanitation and road safety. It is very important to have a road safety, hygiene and sanitation in day-to-day life. Like our President Mr. Modi had already said, to clean every road, and that is so. May I call Mr. Sailesh Maurya to give the citation on this field of sanitation, hygiene and road safety. Thank you. Thank you for inviting me. I would like to first of all thank the Nimble Foundation for its organizing an award function like this and recognizing the contributions made by our exceptional people for the betterment of society. Here I would like to I take an honor to introduce Mr. Pramod Batra, who has done exceptional work in the field of hygiene, sanitation and road safety. Let me give you a brief background about the kind of work that Mr. Batra has contributed for the society. Basically, we all know sanitation, lack of sanitization is the root cause for all the health issues. And his idea was to create as much awareness about the sanitization and at the same time provide with the needy and with the low cost solutions which can be implemented by the society. So he first introduced a low cost sanitizer which can be used, which can be distributed freely in especially schools and rural areas, which children can use before having their meal. This will avoid various diseases like diarrhea and fever. And his other contribution was innovating a mobile Sulabh Shauchalaya. He is the founding member of Sulabh Foundation, which focuses on working and innovating various low-cost products which can be used for sanitization. These mobile toilets are deployed in rural areas which rural people can use, and so that they don't have to go out in open for their basic this thing. And this will be also placed outside school and create awareness in schools about the basics of sanitization and basics of using toilets. His next initiative was launching a campaign called Pinkathon. Pinkathon is basically, he has come up with a brilliant idea of combining sports with road safety, and at the center of the initiative is women. So the idea is to create awareness about road safety in women, who will in turn be advocates and who will guide their husband and children, and they will make sure that there is no rash driving, people are following rules and regulations. So the Pinkathon initiative is basically launching in basically people combine it with cycling and marathon. So create awareness around the road safety with these kind of events, and also get corporate participations who in turn popularize the road safety initiatives amongst their employees. It's my honor to welcome Mr. Batra to share his experience and enlighten the audience with his thoughts. Thank you very much.
Mr. President, distinguished Chief Guest, and ladies and gentlemen, I am truly honored and privileged to be standing here in front of you and getting an opportunity to speak about this topic. It has already been said by my friend here in his citation already about all the work. So I'll not really duplicate the same things which he has said, but here I would like to just make an humble request to all of you that India is a huge country and we are a growing nation. And to be really developed and to be really having a position of icon, I mean as a superpower, we need to really focus on our basic hygiene. It's in our day-to-day life. And I really want all of you to be ambassadors of this hygiene, safety and road safety. And the onus lies on us. The government itself cannot do everything. Modi ji can drive Swachh Bharat Abhiyan, foundations like Sulabh can initiate a lot of mobile sanitations. Organization like Gunj can do a lot of awareness and recycling of unused products for rural India, where people don't get to basic sanitization facilities. So all these organizations can do their bit part, but the onus really lies on each one of us present here, that I really want all of you to be ambassadors. And when you go out of this room, please spread the message to at least 10 people and make them hygiene champions, whereby they are spreading this awareness to 10 other people. And if you see something happening on the road, somebody not following the hygiene and safety things which we should follow, then you please take time and be a role model. If he's throwing something, please pick that up and put it in dustbin. So when you present like that in the society, you'll really build the role models. And we really want a true shining India. And the true shining India cannot be, even in Mumbai, we talk about big cities. But if you go to Gateway of India and you go to the key tourist spots, those are not really hygienically kept. When the tourist comes and you look, I mean, is this the India, developing India? No, sorry, I don't want to carry that image to the world. And I want really you to be the role models and help organization like us to carry that image forward and take the nation forward. Thank you so much.
Mr. President, please award Pramod Batra for this. Now, our last award, which is healthcare. Mrs. Reena Jugani, please come on the stage for the citation of this award. Thank you.
Good afternoon, everybody.
Good afternoon.
And I'm here to introduce to you Dr. A.B. Goritankar, who has been awarded the Nimble Prize for Healthcare. He is a well-known orthopedic surgeon at the LTM Medical College and Hospital at Sion, Mumbai. He has always been a brilliant student and topped in class. His inner desire as a young boy was always to serve the community. And what better than taking care of the health of people? Because we all know health is wealth, which is why he took up medicine. He did his undergraduate and postgraduate course at the LTM Medical College, where he is heading the department for the past 15 years. He has specialized in the spine surgery and the knee replacement surgery, and the numbers of surgeries which goes up to the tunes of thousands. Majority of his work is in the government hospitals, where the huge number of poor and needy are treated. We all know the cost of medical treatment today is very, very high. And he, with the help of the NGOs, has made provision for donations, so the cost burden is not totally bared by the patient. Dr. A.B. Goregaonkar is also a professor at the MUHS University. He also conducts multiple lecture programs, seminars, workshops at national and international levels. He teaches the students to become successful and efficient orthopedic surgeons. He also conducts multiple programs for the community to improve the health and to detect the problems at an early stage. And then goes further to help them solve their problems. What more noble and humble work than taking care of the health of people? Sir, we are proud to have citizens like you in our country. I request Dr. A.B. Goregaonkar to come here and speak a few words and receive his award.
Good afternoon.
Good afternoon.
Yes.
Respected President Sir, Mr. Kakri, ladies and gentlemen. It's my pleasure and I'm honored for the award which is awarded to me today for my work in a field of health. Medicine has been my hobby since the childhood. In a school, whenever somebody is to ask, what do you want to become? Different answer we used to get, but I was stuck with the medicine. I always used to say, I want to become a doctor. What? I didn't know, because that time I didn't know the medicine at all. My passion for the medicine went on to the college days. In the college days, I worked hard and I saw to that I get enough marks to enter into the medicine. After passing the medicine, the first choice I had orthopedics. I thought it is something which is related to the bones and the joints, where the locomotor system, the movement, all depends on that. And therefore, orthopedic became my passion and then became a hobby. Today, I enjoy orthopedics. Not me, but even my patients become better. And looking at the patient, that they are improving, they are doing better, even I enjoy more. In orthopedic also, today the field has become very vast. Whole orthopedic branch is divided and subdivided in a different level. I chose to become a specialist for the spine surgery and the knee replacement surgery. Two important things. Whenever in the past you talk about a spine surgery, even today, it was given in a literature saying that a spine surgery is an element not to be treated. This is, I'm talking about 200 years back, but the whole scene has changed. Today the spine surgery has a different role. It has changed, modernized. Why? Because we have a lot of good infrastructure. We have a good surgeon coming in. The spine surgery is made simplified. Today we do all the surgeries of the spine where patient who was not able to walk, who had developed a weakness and a paraplegia in both the legs, now he is able to walk. He is going to walk to the office, and who is doing much better as far as the movement of the spine and sitting and day-to-day activities concerned. Today we have progressed to the level where we can use a very small incision, use an endoscope, use a tubular system, where the previous surgery where you have to open the whole spine and do the surgery which is not remained. Today what we do is a very small localized incision, a stitch of almost say 1.5 inch and the whole surgery is done. What we call in a layman's language a keyhole surgery. The same thing has happened in a total knee replacement. A total knee replacement surgery came in India about 20 years back. The moment you talk to the patient will say that is not successful. Yes, the things have changed. Whatever is available in a Western country, today is available in India. We have a trained doctor who are trained in a Western country and today they are performing well in India itself. and therefore even a total knee replacement. You have seen the people who are crippled with a bowed leg, not able to walk, and lots of difficulties. Such patients, they remain homebound. Today, after the surgery, they start walking on the next day or maybe sometimes on the same day. They can walk for the many kilometers. They can climb the stairs, and the life has become very comfortable and happy for the patient. All this improvement is possible. I have dedicated my whole work and so many years of work for these patients. And today, not the least, this award does not belong to me. This award belongs to, or dedicate my award to my parents who brought me up and fulfilled my ambition to become a doctor and then the orthopedic surgeon and to serve the people. To my teacher who taught me how to go ahead, and most important, the patients who allowed me to perform the surgery on them, make them realize, yes, this is possible, you can have a better life, and looking at them, many more number of patients are going to undergo the surgery and have a better life. Thank you.
Can I call Mr. President to give the award?
Yeah.
Yes.
Photograph, please.
Bottle pocket was.
Smile. Thank you.
So with this, I would like to conclude the event which is being done. So for the vote of thanks, I would like Mr. President to give a bouquet to Mr. Mr. Satish Kakri.
Thank you. Thank you.
Also, our vote of thanks to Mr. Amit Kakri for organizing such a big event on such a large scale. Thanks a lot. Thank you.
Thank you, Deepak. I would now conclude the